Weight gain is one of the most frustrating side effects of antidepressant medication, and that's what today's video is all about. It's about why it happens, how much weight gain you can expect to happen, when that happens, and then what you can do about it. Now, I'm going to be honest, in preparation for this video, I was really surprised about what I saw in the research. When I did my full review on this, I actually found that the research showed that it was quite modest. However, this flies in the face of my clinical experience in terms of what I've seen with patients and how much weight that they've gained. And it also flies in the face of a survey that we conducted recently. I'm putting the results up here. This is just from our social media, and it kind of shows how much weight gain people had. As you can see, the majority of people said that they gained between 10 pounds to 50 pounds on antidepressant medication. Now, that's not what I saw in the research, but upon looking at it, and that's what we're going to do in today's video, I actually think the research is biased, and I think it underestimates it. And I actually think the amount of weight gain is more in line with what I've seen in the survey and what I've actually seen in my clinical experience. So if you're someone who's looking for a deep dive into this topic, that's what we have installed today. So what are the antidepressants that we're going to look at today? Well, first we're going to look at the first-line antidepressants, and these are the drug classes of the SSRIs. That's like Lexapro and Prozac. The SNRIs, these are things like Effexor and Pristiq. We're also going to look at bupropion, which is Wellbutrin, and Mirtazapine, which is Remeron. Then after those ones, we're going to look at the antipsychotic medications, which are commonly used for treatment-resistant depression and bipolar depression as well. So why do these medications cause weight gain? Well, to introduce this point, I want to show you an image. So what you're seeing here on your screen at the moment is the role of serotonin within the body. Now, as you can see, it has a lot of peripheral effects. It's involved in the way your heart beats. It's also involved in gastrointestinal motility, and also has some immune effects as well. I bring this up not just to overwhelm you with this information, but because a lot of people have this idea that psychiatric medications have these very well-defined roles in our brain, and they simply act on our mood. But the reality is that when we disrupt these chemical processes, these have effects all over our bodies, and some of those are involved in weight gain. As for the reasons that people gain weight on antidepressant and antipsychotic medications, several causes have been hypothesized by Zimmerman and al., who looked at this. And these start with things like altered appetite regulation. So lots of psychiatric medications, in particular things like antipsychotics and mirtazapine, they can interfere with the central nervous system's control of appetite, and they often increase food cravings, particularly for high-calorie and sugary foods. And this can make people crave these types of food, and as a result, they increase their caloric intake and they consequently gain weight. Another reason why weight gain can occur is metabolic changes. So some psychiatric medications affect the body's resting metabolic rate. And so what that means is at rest, your cells in your body are actually burning less fuel. This metabolic slowdown contributes to weight gain, even if patients don't change their eating habits. Next, psychiatric medications can disrupt the normal functioning of hormones like leptin, which regulate hunger and insulin. These control our blood sugar levels. Disruption in these hormones can lead to increased fat storage like weight gain. Some drugs even increase insulin resistance, particularly the antipsychotics, leading to the development of conditions like type 2 diabetes, which is also associated with further weight gain. And finally, many psychiatric medications can actually make people feel sedated. This is particularly true of the more sedating antipsychotics, things like Seroquel, which are often used in depression, but also drugs like Mirtazapine as well, which can make people feel kind of hungover in the morning. Clearly, when you're feeling sedate, you're going to be less inclined to engage in physical activity. This, along with the increased drive to eat food, can contribute to weight gain. One important point I want to make here is that there is a common misconception that the weight gain from psychiatric medications typically just occurs because the drugs make people want to eat more. And so people think if they can have a very strict diet, they can prevent a lot of this weight gain. But the point I really want to make is some of these things are completely out of control from, modifying your diet or even engaging in more exercise. It comes down to things like alterations in your hormones and your resting metabolic weight, which can still lead to some weight gain even with dietary changes and increasing exercise. So let's move on now and talk about how much weight you can gain with these medications. I'm going to start by talking about the first-line antidepressants first, so the SSRIs, SNRIs, Wellbutrin, and Mirtazapine. So the first study I want to discuss with you is that of Petamar and al. This was published in 2024, so just recently. And they looked at over 180,000 patients in medical settings in the US. What you're looking at now is a graph which looked at how the weight changed over time. On the y-axis here, you can see the mean change in weight over time in kilograms. And on the x-axis, you can see over time. So this is how weight had changed over time. This is in kilos. And so for US listeners, 2 kilos is about 4.5 pounds. And 1 kilo is about 2.2 pounds. So let's have a look at the average weight gain over this time. So I think it's helpful to look at the SSRIs first. So this is sertraline, citalopram, escitalopram, fluoxetine, and paroxetine. And what we see in terms of the weight gain from 12 months up to 24 months, it kind of sticks in this range of about 1 kilo all the way up to around 2 kilos for Lexapro. And so it's kind of sticking in that range over time. Next, we're going to go look at Wellbutrin, so bupropion. So what we've seen in this study is over time, there's really not that much of an impact on weight. Maybe at the 24-month mark, we've got about 0.5 kilo there. And then finally down here, duloxetine and venlafaxine, we've got less weight gain. It looks like this is kind of capping out at about 1 kilo over 12 to 24 months. One comment that I want to make here is that the SSRIs appear to be associated with more weight gain than the SNRIs. And that makes a lot of sense because if we think about the SNRIs, they act on noradrenaline. This is a vigilance enhancing and a stimulating neurotransmitter. And these antidepressants are thought to be more energizing. So it makes sense that you might have less of the sedative component and that drug may be associated with less weight gain. Again, we see Wellbutrin or bupropion being associated with the least amount of weight gain over 12 to 24 months. And that makes sense because this is, again, a very stimulating antidepressant that's not associated with sedation. However, the most interesting thing about this is just how little weight gain there appears to be on these medications. And what I will say is this kind of flies in the face of what I've seen clinically. A lot of the times I see patients gaining up to, much more than this, maybe 4 kilos or up to like 10 pounds in a year sometimes on these medications. And what I think is happening in this data is actually that it's skewed a little bit and that it's underrepresenting how much weight gain is added. Now, the reason I think this is happening is when we look at the retention data. So this is here, if you go down to the x-axis here, you can see how many people were still on the drug at these different time points. So obviously at 0, that's 100%. But over here at the 6 months, if we're looking at sertraline, that's 36%. At 12 months, only 21% of people were still taking these medications. And at 24 months, only 5% of people were still taking these medications. And this is seen across the board. And so people who are getting started on these meds in this study, like a 20th of them are still on them 24 months later. The reason I think this skews the data to make weight gain seem less pronounced is because weight gain is one of the most important reasons why people come off this drug. And so that means if someone was gaining weight, they would have dropped out of the study earlier, and only the people who may have been gaining less weight would have continued taking the drug for the rest of that time. And just to give you a sense of how big of a deal weight gain is on antidepressant medications, I want to look at a study that was sponsored by GlaxoSmithKline. This is an antidepressant manufacturer in the mid-2000s where they were asking patients about their experiences with these medications. Now, in this survey of 327 patients, they collected some very interesting statistics. And let's have a look at the first one. So here was the 10 most common reasons for non-compliance reported for patients who received a prescription of an antidepressant. That means not taking it if you were prescribed it. And the second reason there was gained a lot of weight. That occurred in 30% of the people. Now, the next question they asked them was the frequency of adverse effects reported by patients who had received at least one prescription of antidepressants. And again, here we have weight gain featuring pretty high. So this is happening in about 40% of people. And finally, the question, which I think is the most relevant to this topic, was the question of the frequency of adverse effects reported by patients as being extremely difficult to live with. And what we found here was that weight gain topped this list with 30% of people reporting having difficulty specifically with weight gain. And so it's no surprise that this data would be skewed because a lot of the people that were having the most amount of weight gain from these medications would have dropped out earlier on than those who continued to take them to the 12-month and the 24-month mark. Now, quickly, before we go on to talk about the antipsychotic medications used for depression, we need to speak about mirtazapine, because you may have noticed that it was not on that graph we looked at recently. And to do this, we're going to look at a UK study that was done in 2018 that looked at 250,000 people, and they also compared weight gain in the antidepressants. Now, when they looked at this, they found that mirtazapine was actually associated with the most amount of weight gain compared to the other first-line antidepressants. Now, this is not a surprise to any clinicians and probably a lot of patients, because mirtazapine is often signaled out as an antidepressant that we use when we want people to gain weight, when we want to stimulate appetite. It's frequently a drug used in patients who have cancer or who are on chemotherapy because it stimulates their appetite. And so in terms of thinking about where mirtazapine fits into all the other first-line antidepressants, I would consider that one to be associated with the most amount of weight gain. And more quick point on this GAN4 study, which is really interesting, is to look at when this weight gain was occurring. And when they looked at patients, they found that they were at an elevated risk of weight gain all the way up to 7 years on the drug. And that's what this graph shows. And particularly within the first 2 to 3 years was when the most amount of weight gain was occurring. Now, from my perspective, this makes sense that the weight gain may steadily go up over time. This is not something that you kind of adapt to. A lot of these meds may be kind of sedating in the long term. And so if you have a sort of a sedative effect from these medications, or an effect where it's increasing your hunger over time, this is going to accumulate and you're going to gradually gain weight. So now let's shift our focus to the antipsychotic medications and their effect on weight gain. We're going to focus on the second generation antipsychotics that are used for weight gain. And you're going to see some of them up on your screen now. This includes Abilify, Seroquel, olanzapine and fluoxetine combination, Symbyax, Bexpiprazole or Rexulti, cariprazine or Vraylar, and lorazepam or Latuda. Now, the main point I want to make about the antipsychotic medications is that they cause a lot more weight gain than these first-line antidepressants that are frequently used. While it might be fairly common to gain maybe 10 pounds on an antidepressant within the first year or two that you're taking it, one of these first-line antidepressants, with an antipsychotic medication, you could gain 10 pounds within 2 months of taking it. That's just the magnitude of how much more significant the weight gain is with these medications. And in general, this was what was found where Sabe et al. In 2023 published a study looking at 11 different antipsychotic medications. They did a meta-analysis just to look at the weight gain from all these meds, and they did find that. They found that there was wide variety between the amount of weight gain which was gathered. But for some of these antipsychotics, especially like olanzapine, people were gaining up to 8 pounds in 2 months, which is quite a lot. They also found in that study that the weight gain increased depending on how much of the medication you took, meaning that if you took a higher dose, you would gain more weight. And in addition, they found that this weight gain did not plateau. In fact, the longer you were on this medication for, the more weight you gain. Another interesting finding was that the weight gain on these medications was not equal. In fact, some of these antipsychotic medications were associated with much more weight gain than the others, and that tended to be the more sedative antipsychotics, with olanzapine being the worst, followed by Seroquel, and with the more activating antipsychotics, things like Abilify and cariprazine and Geodon, the medications that I tend to think are more associated with stimulating side effects, things like Abilify, they were associated with less weight gain. Now, I want to be very clear here. That doesn't mean that you can't have substantial weight gain on some of these more stimulating antipsychotics. In fact, I've seen that a lot as well. It just means that they're associated with less weight gain than the more sedative antipsychotics. It's also hard to underemphasize just how substantial this weight gain can be. In my clinical practice and my experience being a psychiatrist for nearly 10 years, I've frequently seen people gain over 50 pounds on these medications while taking them. And just recently, I interviewed Russell, who gained over 100 pounds shortly after being prescribed an antipsychotic. And finally, when other researchers looked at antipsychotics and some of the risk factors for the people who would gain the most weight, Musil et al. In 2015, they found that patients who were younger and who had the lowest weight or the lowest BMI when they started the medications tended to be at the highest risk of gaining the most weight on antipsychotic medication. So what can you do about weight gain on antidepressant medications? Well, the best strategy is, of course, prevention. So this means avoiding to take these medications if it's possible. Now, I understand this may not be possible for everyone. However, I do see a very concerning trend in the way psychiatry is practiced, and that is that patients aren't often helped finding alternatives to medications. Many people report seeing their doctors and being diagnosed after they quickly review their symptoms, sometimes even in a checklist, and just getting started on a medication. After they see that doctor, they may only see them every 2 to 3 months, and they're only really asked about their symptoms, and if their symptoms are going up, they increase the dose, and so on and so forth. And what these patients are reporting is that it feels like the doctors really aren't invested in getting to know the root cause of their problems and trying to help them find non-drug approaches to address their symptoms of depression. Now, these could be things like psychotherapy if they're having interpersonal problems or if they're trying to find their direction in life. But it can also be things like just dietary interventions. I'm seeing so many people these days who are having substantial improvements in depression and anxiety and even more serious psychiatric conditions like schizoaffective and schizophrenia with ketogenic anti-inflammatory diet. I understand that may not work for everyone, but I am seeing a lot of people have benefit from that at the moment. And finally, a lot of people can feel depressed just for medical conditions, things like sleep apnea or autoimmune conditions or post-viral symptoms that all have their own individual treatments. And a lot of these things aren't being worked up by the doctors who are looking after these patients. And so before you start an antidepressant, you want to be really confident that you're seeing a provider who has thoroughly evaluated you for ways that your depression could be treated with non-psychiatric medication approaches first, and then only relying on these medications if you've tried all these other things and you're still having substantial symptoms. Now, what can you do if you need to take medications anyway? Let's go over some of these approaches. So, firstly, there's dietary changes. If you're gaining weight on these medications, you could implement a structured diet plan that focuses on reducing calories from high-fat and high-sugary foods, and this clearly can help mitigate weight gain. Also, regular monitoring of weight and dietary habits, often with the assistance of a nutritionist, can help you stay on track with your weight management goals. Also, mindful eating can be really important, where you make sure that you're only eating when you're focused on that task, because a lot of people, they may eat when they're watching TV or when they're bored, and that can lead to overeating. And also, healthy snacking can be really important. A lot of these medications drive people to crave food and to crave snacks all the time. And so if you just have these healthy snacks around, things like carrots or celery, you can snack on those, and those obviously have less calories than some other snacks. Next, increasing your physical activity is going to be important to offset some of the weight gain. Now, this can be jogging, bike riding, swimming, light exercises, whatever kind of sports that you enjoy. Most health guidelines recommend exercising for 30 to 45 minutes most days. Before we move on to talk about some of the other interventions, I just want to stress that if you have changed your dietary habits and you're exercising and you're still gaining weight, that doesn't mean that you failed at these things. As we've discussed previously, a lot of these drugs alter your hormones and your basal metabolic rate, meaning that even with these interventions, you may still be gaining a little bit of weight. So the next strategy for reducing weight gain is going to be switching to a drug associated with less weight gain. And so let's say you're on Lexapro, but maybe you could tolerate Wellbutrin, you might try swapping to that drug. If you're on Seroquel, maybe you could take Latuda, and you might consider swapping to Latuda as that's associated with less weight gain. Next up, there's some meds out there that have been used to decrease the amount of weight gain. Honestly, these are not great because now you're taking another medication for a side effect of a drug. And so a lot of patients on antipsychotics get put on metformin to prevent the weight gain. Honestly, that does not work very well. People do not see a lot of weight loss with that. And then all of a sudden, you're dealing with all of the side effects of metformin. You're at risk of things like lactic acidosis. So really, that's not ideal. There's other drugs out there like topiramate, which people sometimes add, but that causes a lot of cognitive problems as well. So I don't really recommend that. And then there's other drugs out there like orlistat that prevents the absorption of fat, but then people have a lot of diarrhea with that. And so taking medications to mitigate weight gain, clearly not ideal. You're going to end up with dealing with all the side effects of the new med. And finally, for people who have a lot of weight gain, some people actually undergo bariatric surgery for this. They get gastric sleeves and such. Again, now all of a sudden you're paying for a surgery, and then also you can start to have malabsorption problems as well. I mean, if you're going to surgically alter your stomach, that's going to affect the way you absorb nutrients as well. And so that's really not ideal to be getting surgery. So there you have it. That's our review of antidepressants and weight gain. I'm really curious to know, can you please tell me, what has your experience been like with antidepressants and weight gain? Did you gain a lot of weight? Did you not gain a lot of weight? I'd love to hear all about it in the comments below this video.